Hi everybody and welcome to the BMS Podcast. We all have different perspectives on health, disease and illness that are all shaped by our socio-cultural environment. The aim of this podcast is to raise awareness on different socio-cultural belief systems toward health and promote culturally sensitive approaches in a Western secular environment. Hi everyone and welcome to the second episode of the BMS Podcast. Today we're very happy to have one wonderful colleague with us from Canada. Jen Stark is an osteopathic manual practitioner and she's an author. She wrote an extensive book on the life of William Garner Sutherland, an osteopath, the osteopath who developed the osteopathic cranial concept. And we all know there's a lot of controversy around this model, especially with a lot of evidence against the model that was proposed almost 100 years ago. But it has helped a lot of people, and it has helped build a professional identity. So this is why we're very happy to have Jane in order to help us sort out what belongs to history, what belongs to science, and what belongs to clinical practice. So thank you, Jane. Maybe you want to add something about your work and what you do as an osteopath?
Well, I've written half of Sutherland's biography. I'm here in Kirksville doing some more research to finish the second half. The first book is about becoming an osteopath, and the second one will be about being an osteopath. I have 90% of my data. It's just a matter of finding time to write it. Yeah.
Okay, so like you say, it's more a biographical work and historical work on the man, who he was and what.
Sure, and in doing so, I've run across quite a few of his approaches, techniques, ideas. So I can't really separate the two, but I'm trying to stay on the biographical path and leave a historical marker so that nobody has to go through what I did again. If they want to find any information, it's all referenced there. They might have to follow a few breadcrumbs I left for them because I can't put it all in the book, but it should be all together in one place.
So wonderful. Thank you for this artwork. Maybe for people unaware of cranial osteopathy, basically maybe we could describe it as a gentle touch over the skull. And this man, William Garner Sutherland, was the first to describe it in the Western healthcare environment. Is that correct?
Well, he wouldn't want you to call it cranial osteopathy.
Okay.
He would want you to call it osteopathy because
Okay.
it's part of the body, and everything is interconnected, and we've left the head out the first 30 years or so. So it is osteopathy exclusively within the cranium and the cranium itself, but Sutherland didn't specialize in cranial osteopathy. Every class he had, he talked about how it was related to the whole body. He demonstrated techniques on the whole body. The students practiced the whole body. And he always gave credit to Still. He was a really humble man. And he said, you know what, as he said, I pulled the tail of the squirrel out of the tree a little bit more. And, here's the head.
Okay, so for people unaware, so he wrote this book, The Cranial Book, that was published in 1939. So I have to confess that I've started to read this book and I finished at page 30 and never had the opportunity to finish.
Yeah. The Cranial Book is boring. If you want to go to sleep, read the Cranial Book because it is his detailed description of the articular surfaces of every bone, almost every bone in the cranium. I don't think he actually printed everything that he had. I don't think he had all the material. He had to make something small and manageable because he was self-publishing. So yeah, if you don't have the bones in front of you and you're just reading that, you can't possibly visualize what he's done. But anything, even if it's a millimeter in size, he's described it. And then with his mechanical background, which you can read about in Journeyman, he's linked those with 50 other mechanical principles. So if you don't know what a universal joint is or a jigger, reading this, it's almost impossible. However, the footnotes, if you've read the footnotes, they're completely different. They're describing how he could feel his own cerebral spinal fluid moving either anterior, posterior, anterior in the cisterns in the base of the cranium. He says he could stop the convolutions of his own brain just by thinking about it. Now, ask yourself if you can even feel your own brain. Okay, so read the footnotes and you'll wake up. But the actual text is just descriptions of bones. But what's really important about that is nobody in the English language had ever done that before. So bones are described everywhere. The foramens, the holes, the surfaces, the attachments, the eminences, all of that, but not the surfaces. So he's really the first person who ever done that. It was a painstaking job.
Okay, so before jumping into what evidence says against this historical model, maybe you could give us some information about the man he was, because he had a previous working life before meeting A.T. Steele and studying in Kirksville.
Right. So he was born in a northern United States. They called it West then because the border hadn't made it to California yet, but it was in Wisconsin. And his father had really, really bad luck. A lovely man. I'm sure he came from a loving family, but he just made bad decisions and had bad luck on top of bad decisions. So the family was hopping around from location to location, probably with the help of the Freemasons and a lot of brothers and sisters. So the parents had a lot of brothers and sisters. So Will was the second child of 4. And around the age of 13, the family decided for him that they would put him in with a newspaper publisher to learn the trade of newspapers. And that took pressure off the family from trying to support another child. It allowed or ensured that should he follow through with this for the 3 or 4 years of apprenticeship, that he would have a job. And so he started off as a little apprentice in a printing newspaper company. And those letters are like tiny, tiny, tiny. And you have to put them upside down and backwards in a stick and then transfer the letters from the stick to a frame and the frame to another frame and lock it in and then print a copy. It was painstaking work, 10 hours a day, 6 days a week, but a little bit shorter on Saturday. And within about 6 months, the newspaper guy, his mentor, moved. So he actually left his family and they started moving around different newspapers. But he did get his credentials. The other part was doing printing. So compositing is putting the letters together, but printing is watching the 3 machines work. The hand press, more of a foot pedal press, which was a bit faster, and then the cylinder press. So he worked on all the 3 major types of presses and had to be responsible for repairing them. This, I think, is where he surely picked up his mechanical aptitude. With the letters, and I can't tell you how small they are, but he had developed fine 2-point discrimination at his fingertips because you couldn't see them, you had to feel them. And then the concentration of doing this words, like reading it from here and transferring it upside down and backwards all day. and the motor memory of going into, there's where the letter E is, there's where the letter F is, there's where the letter Z is, like this motor memory, this fine point discrimination, concentration, mechanical aptitude, that all set him up. So and then he went back to school and learned Greek and Latin, which if you've studied anatomy and physiology, having a background in Greek and Latin also puts you ahead of the curve, right?
Mm.
So his last position was as a reporter, and that was 1897. And as a reporter, he was covering osteopathic stories. And that's how he heard about osteopathy. And that's why he decided he would go. He delayed a year, but he got a scholarship. He got a full scholarship to go. So he gave up that business and he went to the ASO in the American School of Osteopathy in 1898. And at that time, they had the best faculty ever. 3 of Still's sons, the 3 Littlejohns, the trained physician, what's his name? William Smith, renowned from Scotland, Still's right-hand man, Grant Hildreth, the 3, Marion Clark, McConnell, and Charles Hazard, and then Still was still active. So these guys were like the bee's knees, the absolute best faculty. So he went through there, graduated in 1900, set up practice at home, which is now in Minnesota. So home, his parents made it back there. He set up practice in his living room. And it was really, really hard to get started. Very, very hard.
Okay, so it may explain a lot of skills he developed later in understanding more specifically the importance, the role of the skull, of the cranium into the whole body healthcare. I've read a paper a couple of years ago where he may have been influenced by the work of Swedenborg. There was a paper published in the iJOM, I think, from Theodore Jordan, and this paper states that Swedenborg published a book in 1744 called The Brain, where he was talking about cranial bone mobility, cerebrospinal fluid movements. So a lot of things that we find we also find in his model, in his historical model. Do you have any specific information regarding this potential link?
Yes and no. I think he had his idea well developed, or his sense of what was going on well developed. And he, at that time, surrounded himself with this cranial family, as he called it. And they all had interests in certain non-traditional medical belief systems. Let's call it metaphysics. A lot of them, all of them did. And I think it was Raleigh McVicker probably that knew Swedenborg because he was reading him one day. And I think Sutherland then said, oh, geez, there's my answer. More so than I'm going to read him first and try and make Swedenborg's application fit what I think. I think he was well developed before he got his hands on anything by Swedenborg. He does mention Swedenborg's name 3 times in his collected works, which was edited by N. Wales. And I've spoke to a few people who are sort of well-versed on this, and we pretty much agree. The 2 great minds, okay. 100 years in advance, sort of having the same thing, but of course Swedenborg's was so much more scientific and thought out.
Oh, thank you.
I don't think he borrowed his ideas from Swedenborg.
Yeah, and I see that there's no problem. at least for my side, to borrow ideas from others, and especially if he
No,
cited.
but you need to give them credit. If you do that, you need to.
Yeah,
Yes.
he gave credit, like you say, to Swedenborg and to A.T. Steele. And thank you for these explanations. And you have outlined something very important for our podcast, which means that we want to bring more, I would say, comprehension on different worldviews, especially between the Western healthcare shaped by evidence and the traditional healthcare shaped by more spiritual healing, more faith-based and close to nature, close to natural healing powers. So, and you just talked about metaphysics, and you've also talked about the possible influence of Freemasons. And do you have more to say around that? Was that common at that period of time in the US?
Okay, just for clarification, his father was a Freemason. He was not a Freemason. So the Freemasons were assisting his father in settling down after all the bad luck trials. Metaphysical ideas, although they weren't called metaphysics at the time, but mind healing, religious science is called, Christian Science, quite a few others. I can't remember them all right now. They were quite popular, and they're all coming. If you look back, they can all be traced to two people. One is Swedenborg, and the other one is Anton Mesmer.
Okay.
Everything goes back to those two guys, and they didn't know each other. They had different approaches, but they don't even know it anymore. But even motivational speakers who are talking about use your mind, it all comes back to those two guys. They've just lost their connection to how they came about with that idea. But you have Phineas Parkhurst Quimby as the sort of creator of a concept called New Thought. New Thought was very, very, very prevalent, but it was unstructured, so nobody could really grasp it because it was very nebulous. And then on the other side of that, you had Christian Science. This was highly structured and dominated by one woman. And the only cranial family member that was linked to Christian Science, which actually, it served very, very well, but in some cases it could be just horribly gone wrong, horribly. And the person who was involved with Christian Science was his wife, his second wife, Ada Sutherland.
Okay.
Okay.
Okay. Again, people will listen or will have a look at this podcast and may interpret those information in totally different ways depending on their sociocultural backgrounds. If it's normal to talk about the spiritual dimension into healthcare or not. In some countries, this is absolutely normal. In others, like here in France, this is not the case. So I think that's why we're very happy to have you today, because it helps us understand that at the time of William Garner Sutherland, it was quite common to have this kind of thought. It was not something weird out of nothing. So the time and the places were more in favor to have such importance, to put such importance on this aspect.
Yeah, and I'll go through that in the second volume.
Okay.
Yeah, that'll be written down.
Okay, thank you.
Yeah, the problem with writing about William Garner Sutherland is he didn't leave any information about himself. He only wrote about his work and nothing else. And Ada, his wife, who wrote the With Thinking Fingers, the only existing biography, didn't have any pictures, didn't have any dates and didn't have any references, and was more of a look how great my husband is, and this is what he was trying to portray. So even mentioning the first wife, she doesn't say the first wife by name. She doesn't even call her the first wife. All she says is Will ended his bachelor days.
Okay.
You see, so it's not an unbiased biography by any means, and I'm trying really hard, because I also wrote something previously on still, to just present the evidence without having my own bias put into it. Like here it is, and it will be interpreted differently by others. I might write an epilogue at the end that gives my slant on it, but that's not my job. My job is to collect and present the evidence.
Yeah, thank you. Thank you again. And how was his work received the first time he presented his book and his new theory by colleagues?
Not good. No, not good. He tried to submit the Cranial Book to the journal, to the American Osteopathic Association, who had a special board of, I think it was called professional development, and they rejected it, saying, I don't have that information right at hand. It's around the corner in the reading room, but we can't follow your thought. So no, certainly not by the whole profession, but a few people said, whoa, that's really good. I'm interested. And he got a few invitations to speak, and those like at a fraternity, for instance, and that led to something else, and that led to something else, until he was teaching 2 to 3, maybe 4 times per year around the country. But he didn't present his idea under the name William Garner Sutherland. He presented it as Blunt Bone Bill.
Oh, I didn't know.
Oh, yes. No, his first writings were not under his own name.
Okay.
For fear of ridicule. So Blunt was the place that he was left with the publisher in Dakota, South Dakota. Bone, of course, makes sense. And Bill is a nickname for William in English. So that's how you get Blunt Bone Bill. And then if you wish, he came out of the closet in a couple of years later when, people started to pay more attention.
And any ideas why his work was rejected? Because you said he was an humble man, and he gave credit to Steele. He didn't want, like you said, he didn't want to create a very specific aspect of osteopathy focused on the skull, but another way. So it was too challenging for.
Well, the first thing he wrote was about, not the very first thing, but in the 1920s, was about using sandpaper on your fingers to become more sensitive in your fingers. He used straps and pulleys to suspend people from the table, lifted them off from the table, and he could do his work indirectly more like this. So he came a long way from, putting your head in a, cap and swinging it from the ceiling. And I don't know why it was initially rejected, but he wasn't clear. I think that's probably the most important thing. And he had a big concept to present in a very little space. And the cranial concept really fits a complexity paradigm, not a linear model. When you look at those 6 elements, which one comes first? He changed his mind which ones comes first. But when it all comes down to it, you are asking the question, what is life? This is something all philosophers at all times have asked. And there's no answer to what is life. And people want to know what is life, and there is no answer. It's a phenomenon. That's what we're feeling. It's a phenomenon. It's in a complexity paradigm model, really. So how do you put that on paper, and how do you present it to linear thinkers?
Yeah, that's even more challenging today. So I know you work on the biographical part, and but today there's a lot of systematic reviews published that are against this model, the historical model that was introduced by Sutherland. And so I think you are already aware that many university college have removed its teaching because there's science against. Here in France, this is officially considered as a pseudoscience, but many people, many colleagues still use these techniques because it helps a lot of patients. So what would be your opinion on that as a clinician and as an educator, because I know you're running workshop as well.
It would take me a longer time than we have to explain all this. It took him really 40 years of his professional life until he was ready to say, this is the cranial bowl, and maybe 5 more years after that to really introduce the concept of the primary respiratory mechanism. And students are being taught that so early in their career. How do you feel that? But you want to learn osteopathy. So I think there's a lot of, yeah, I feel it. When no, I don't really feel it. I don't feel it. But you can't learn more unless you agree that you feel it. But what I've done, and this may sound a little self-promoting, is I've looked at the work before the primary respiratory mechanism, when the focus was mechanical and the goal was venous and lymphatic drainage. The first cranial technique came out of his work on patients that had had the Spanish flu in 1918, and he took again 10 years. But what he noticed and observed in these patients with the Spanish flu is that they had a kind of tensity. He called it an anterior tensity. And his work in the cranium was to release that tensity, which affected the whole dural system. So first technique was drainage through venous drainage through the jugular foramen. He had 2 different techniques for that. He had lots of sinus stuff, but it was all for drainage. So he said, why would you worry about the arterial flow? If you take your car to a mechanic, do you want him to put in fresh oil or drain the old oil? Like, what do you do first? So it was drainage. And this work, again, for the whole body, not just drainage, but to release this tensity, is the workshops that I'm trying to teach now internationally, mostly in Germany, but I will be, as you said, in the Netherlands next year. But this is so valuable. It's so easy to perform. Pressure headaches, and it happens time and time again. These 2 seconds. 2 seconds with a technique, and they're already feeling relief. So I can't say enough about it. The primary respiratory mechanism, I think, was his personal what is life answer, because he was in that metaphysical realm with his cranial families. They were studying he didn't write any of this down. He didn't tell you this. I know this because I have letters from his wife that describe all this. But they were studying with Anne Wales, studying with Chester Handy, the meaning of life, or the science of being. It was called the science of being. That's what they were studying. And there are little chapters and there are little exercises you did each day or each week, whatever. And I think as he aged, we all asked the question, what happens next? You get interested in where you came from, what life is, where are you going to go? And I think that's what changed, is his interest in that and trying to find out life. And that work is not necessarily the first thing your patient needs. Okay, where you go floating in the cosmic atmosphere, feeling a rhythm that somebody told you exists. With what is it, 30 or 3 trillion cells? Can we all feel the same motion at the same time, even if we were on the same place at the same depth? Would your experience be the same as my experience?
Yeah. For people unaware, Jen and I are invited to the same conference next year in the Netherlands, and I will give a talk, tricky talk on the cranial concept. What does science say today? And well, the thing is that I have many colleagues who say I do not use cranial techniques anymore on my patients because there's science against this model, and that would be unethical to use such techniques on patients. I can understand this thing, but what would you say to those colleagues?
Okay, well, I mean, their toolbox must be very limited, because what have we proven works in osteopathy? Okay, if you're only using those things that have been proven, what are they? I would like to know. And you cannot do, I'm also, I have a master's in science in research administration. So I know how pharmaceuticals, for instance, test their drugs. I studied that for 2 years. And we can't test osteopathy the same way, because they assume they'll take 50 people with a heart condition and they'll, see if their drug works. If you have a patient in your office with a heart condition, they don't have all the same reasons for having that heart condition. You can't treat them all the same way, because the reasons that they have the heart condition are different, right? So
yeah, I agree. We have specific methodological design to evaluate non-pharmacological therapies such as osteopathy or acupuncture or psychology, compared to the study of pharmacological product, which is easier at least from a methodological perspective. So just that's the
yeah, but let me finish, because what happens then is, if you were to do the study, okay, so the drugs do their way, we do it our way. In the end, the pharmaceuticals have side effects. So they're not side effects, they're effects. That's what happens when they took the drugs. They're not side effects. But when you look at the osteopathic studies, where's the side effects? There's very few side effects, because you treated the person for what they had, all of what they had. You don't have those side effects. I don't want to die. I mean, side effect of osteopathic treatment is not death. It's not rashes. It's not fibrulations. It's not, well, it's not. It's completely different. So if you compare the outcome, yeah, these people have better results taking the heart pill, but the list of side effects is like this.
I agree. It is clear, at least my understanding of the profession is, we have two different groups. One led by security belief, that one, they want to comply with the dominant biomedical model, and if there are some weird historical theories with limited evidence or evidence against, it's okay for them to remove this. And other group who are more focused on, who have more gross belief, that are okay to have a part of unknown within their practice. So that, at least that's my understanding today. So probably when we meet next year, I will have a different opinion. But I've always seen in the profession people that wanted to go back to the something more common, and other that wanted to explore the unknown, especially all those metaphysics components.
But consider, the colleagues that are saying it's unproven, it's very likely also that they can't feel what they are told to be feeling. So I wouldn't do it either. I wouldn't do it either. It takes a certain sensitivity, and they may be very, more comfortable using a mechanical approach, and that's absolutely fine.
Yeah, and the way we're trying to move forward with this opposition is to, if we really want to provide person-centered care for a lot of people, it makes sense to receive a gentle touch over the skull to feel better. Why would we say I can't do that? And on the other sense, it would mean that would be unethical to propose such treatment for people that will not ask such treatment. So this is why we're focusing on the sociocultural health belief systems, and some are more prone to have Western belief system, and like you say, the linear cause and effect model, and other like it's commonly used and described in traditional medicine. It's more circular, just systemic, just interaction. So it really depends on what the patient's expectation and values. So one of the three pillars of evidence-based medicine. So in a sense, we truly providing evidence-based medicine by proponing some historical techniques. At least that's my thoughts today. Okay, so I know that you've been recently to you said California, to where he lived. What did you expect something special? It was to put your information into context, or were you seeking something different?
Well, there is a chapter in the Contributions of Thought. Again, it's a collected works. It's an edited collected works, where he talks about the tide, and he loved to sit beside the water. I went because I went everywhere. I've knocked on all the houses that he'd lived in. I mean, I just knock and say who I am. Usually I'm lucky because I'm Canadian, so I'm not so scared. And I'm an old lady now, so that helps too. And I ask, can I come in?
Okay.
So I've been in not just that house, but I didn't expect to see ghosts or hear voices or, be inspired. And I wasn't. But he's so vague in that one chapter about liquid light and the intelligence with a capital I and the fluid within the fluid. And he talked about a lighthouse that he could see. So I went to his house, and sure enough, there's a big lighthouse there, and the lighthouse reflects onto the water, and I can see how there could be liquid light. And I sat in his study. Of course, the house had been completely expanded, but I knew enough from the letters I had from his wife where everything was. So I just sat in his study and said, oh, the lighthouse was there, but a big cypress tree had grown up in front of it, right? But the ocean is only 500-600 meters away. There's just a golf course and the ocean, and the waves are crashing and crashing. And he talked about even a rock can be reduced to sand by the power of water. I don't know the exact quote right now, but you see these rocks are getting belted and belted and belted. So they absolutely loved it there. And he only lasted 3 years. He died in 54 while they were living at that house. He died in hospital, but I've been visiting every place that he lived.
Well, thank you for this hard work. I think we're getting close to the end of our chat. Like you said, you are finishing a book. Would you say a couple of words of its contents and what's inside? Just
Well,
big titles, of course.
sure. I've been working on and off on his biography for it must be 14 or 15 years now. So
Okay.
every time someone asks, it's always 2 years away. So I would say it's always 2 years away. Even if you ask when I see you next year, it'll be 2 years away. But it is from the time he sets up practice until his death.
Okay.
We'll go through, there was periods of decades. The first decade was, this denial that the bones could move. The second decade was testing the null hypothesis that they couldn't move, which he had to reject and accept that they did move. Third decade is what happens if they don't move, and that's when he did all his skull crushing experiments. The fourth decade was teaching, and then the fifth one, well, he didn't finish because he passed away, but it'll be spread out like that with as much context as possible.
Okay. So thank you very much, Jane, for this wonderful chat and for all this information that help contemporary practitioners understand the origin of this historical model and all the challenges it faced since inception, we would say. And so thank you again. If you want to add one last word, because I know you're in Kirksville.
Yeah, I'm in Kirksville. I have just before the pandemic, I came and I wanted to find out where he saw that disarticulated skull. And I found a janitor and another professor here that was also interested. We got the keys, but that part of the building had been demolished. So we had to go in another building, crawl down a fire escape, and stand on what was remaining, the roof, which was formerly the floor of. And I stood right where that disarticulated skull was. I just have to do it. I don't know. That's what I do.
Wow, fascinating. So thank you again, Jane, and see you next year in the Netherlands.
Okay.
Bye.
Bye.
Thanks for listening to the BMS Podcast. We hope you've enjoyed our chat today. BMS Formation is working to bring more compassion and tolerance between people holding different worldviews in healthcare and beyond. Share it if you like it, and see you soon.